We have a photo of you actually getting treatment. You were, I believe, receiving radiation.
Yeah.
And this is the form of treatment that you...
That's me. Yeah, so that's the day that they actually mark your body to make sure that, you know, every day you come in and it's a very quick process. And that's where exactly where the marks are. That's where the layers, you know, the lasers shoot you through.
And that's where it's administered, correct, doctor?
Yeah.
Yes. So radiation treatment is obviously is a must in a patient that has preserved her breast and has a diagnosis of invasive breast cancer, like in the case of Clara. There was no advantage of doing a mastectomy, so here we're pitching on the topic of double mastectomy.
Right.
Did she really needed that? And probably the answer to that, the answer to that is no. And I think she chose wisely and decided to do breast conserving technique on the affected breast, not doing anything on the contralateral breast, more so and continue with the screening. And for that, we needed radiation to actually make it happen.
And Clara, what was treatment like for you? What was it difficult? I mean, not just physically, but mentally, emotionally. How did you get through that process?
It was draining physically and mentally. I mean, one of the things that I want to add is that the reason why I also chose the lumpectomy is because my BRACA came back negative. Had my BRACA came back positive, that would have been a huge factor in the fact that I would have gotten a double mastectomy.
Yes.
And going back to your question, it was very draining, you know, going into the hospital every single day for 30 days in a row get to be very draining. And then the actual radiation, you don't feel anything while you're laying down there, but the rest of the day I felt my right breast cooking. I mean, one day I got a thermometer and I put a thermometer on the left breast versus the right breast, and the right breast was 8 degrees hotter than the left.
Oh my goodness.
And it burned and it was uncomfortable. And it just physically, like, completely just drained you. I was tired all the time. And then when I was on tamoxifen, the first 3 months, I would fall asleep right here, like talking to you. It was very, very draining. But, you know, it wasn't compared to, I feel like, the chemo or anything else. It wasn't so bad when it comes, in hindsight of it all. The fertility treatment was also something that was pretty tedious, but I thought it was something that was very important that I needed to do because it prepared me mentally for, like, I was unconsciously telling myself that I was gonna have a future. So
right.
that was very important to me.
That's